It's known as a black box warning from hormone replacement therapy products for menopause. That warning connects the drugs to a risk for breast cancer. So joining me now is Dr. Jon Mendelsohn, Medical Director of Advanced Vitality, and Donna Abdelnour, Women's Health Specialist, to explain more about this decision. We were talking a little bit during the break. For a lot of years, hormone replacement therapy for women has kind of been shunned. Why is that?
Yeah, so this is a monumental time for women's health. The black box warning has finally been lifted. We've been trying to do this for a really long time. That black box warning was placed on all estrogen products, saying that the hormones increase risk of cardiovascular disease, breast and endometrial cancers, stroke, potential dementia. These were based on flawed studies that came out in 2002. The HERS trial, the WHI study, the Women's Health Initiative. It's a very large study. It came out. There were a lot of the women in the study that were an older population and were already prone to these risks. And based on that, this box was put in place.
Right.
We now know that for patients that are good candidates, it actually is very beneficial. Hormones are cardioprotective, they are osteoprotective, they are brain protective. That means that you actually have a decrease in cardiovascular disease, decrease in cognitive issues, decrease in osteoporosis, decrease in body composition and fat, decrease in symptoms, being vasomotor symptoms, hot flashes, night sweats, mood issues, sleep issues, skin issues, joint issues, hair issues.
So it's extensive.
Quality of life, sexual health, all of those things.
When we say hormone replacement therapy, there are a lot of people who are probably wondering how it works. And I know there are a couple different ways that you can take advantage of hormone replacement therapy. What are some of the treatments? What do they look like?
So as far as hormone replacement, we want to make sure that you're a good candidate. So make sure that you talk to your doctor. That's very important that we get that out there because it is still not for everybody. But it comes in different routes. The safest routes we know are bioidentical. We know that they are any of the transdermal, systemic, intramuscular, so patches, creams are much more safe than any oral medications.
We talked about the disservice of a lot of women who have suffered through menopause for a lot of years. Just this change, how monumental is this?
So it's unfortunate. An entire generation of women, we did them a disservice for sure. They were not placed on hormones. There was this fear mongering. There was this constant fear about starting hormones. Unfortunately, some of them are now outside that window. So guidelines say less than 60 years old, less than 10 years postmenopausal are good candidates. So unfortunately, people outside that, we have to talk about other options.
Dr. Mendelsohn, what are some recommendations for women who may be considering this?
Yeah, well, first of all, it's not for everybody. We do want to look at past medical history and make sure it's safe to do. But we usually will start with looking at lab values, an extensive panel of labs to make sure that not just the hormonal aspect, but the endocrine aspect to make sure our systems are looking good so that we can support other things. One thing I'd like to add to that is there are many women also with HRT. We're talking about estrogen mainly with this black box. Testosterone is actually something that many women use as well. And you were talking early, before we started here. That's not covered by insurance necessarily, but it really does offer women vitality and the opportunity to feel well.
And a lot of times I think that we just accept that it's aging and don't question if there is something that can be done. Just for anyone who may be asking or wondering if they're a candidate, just taking that first step.
Yeah, I think getting that extensive lab panel to evaluate what's going on, there are many things that we can do to help.
Awesome. Thank you both so much for coming in and sharing the reversal of this black box warning. I think it's huge. So, all right, Alexis, let's send it back to you.